Okay, I think we can start now. Is that okay?
Yes.
Okay. So I'll start by introducing our topic today, which is basically virgin coconut oil and monolaurin, which is a derivative of virgin coconut oil. But specifically, we're going to be talking about virgin coconut oil and monolaurin as antimicrobials, meaning antibiotics, antifungals, and antivirals. Um, if you have any questions, seriously, just keep them coming. We have some people helping out in VMV to try to make sure I don't miss them, and we'll answer as many as we can. We also have some that have been pre-submitted, so we'll try to get to those as well. Today I'll be chatting with one of the foremost experts on virgin coconut oil and monolaurin for skin. Some of the earliest randomized double-blind clinical studies that have been published and are still really regularly cited in medical literature are this lady's right here. Dr. Viralio Rowell, her friends call her Verm, is also my mom, also happens to be our founding dermatopathologist, and she does do teleconsultations, which I'm not sure if she's comfortable me saying, but if you do want to talk to her about your case, you can DM us and we'll help you make that happen. I should emphasize that as not only does she do regular clinical studies on virgin coconut oil and monolaurin for skin, but she regularly uses these in her clinical practice for years and years and years and years, even for her hospitalized cases. So it's really nice because for me, I get to hear about the research, but I also get to see it through her in her clinical practice, right? So say hi, Mom.
Hi. I wanted to talk, I hope you don't mind. History is always nice to go as a background, I think. The reason I got so interested in coconuts is that I went to the World Congress in Beijing in 1998. Yes, 1998. Met Dr. John Cabara, who's really a pioneer on the studies on coconut oil. And this was back in, I think, Atlanta or Chicago or Michigan. I think he went from one place to another. But he made all of these fantastic studies on coconut oil and monolaurin. And then after he gave that talk, I went to him and I said, boy, those are really impressive. You mean to say the coconut that I have there in the backyard of our home has all of these properties? Very nice gentleman. He said, yes, it is. And I said, yes, sir, but those are just laboratory studies that you've done. And he looked at me kindly and sweetly and he said, I've done my job. Now it's your time. So I came back to Manila, and what I did was I said, let me try this monolaurin as a hand sanitizer. I wanted to tell you this story because now is the time everybody's using hand sanitizers. So I did first just 15 patients on each side. One group was using just the base of the monolaurin without monolaurin. The other group of 15 used the monolaurin. I'm really sorry. It was isopropyl alcohol that we tested it against. At the end
Okay,
of
are
1
people
month,
catching this? So this was the clinical study in actual use of monolaurin against isopropyl alcohol, which is a standard for disinfection.
yes, and this was done way back in 1998, 1999. It got published in 2000. And the result, the monolaurin, my goodness, it was as good as the
Isopropyl alcohol.
isopropyl alcohol, except for one thing. After 1 month of using every day, 2 or 3 times a day, the isopropyl, they were complaining of their skin being dry and itchy and red. We look at the monolaurin gel users, and they were extolling the fact that their hands felt very nice and soft.
Right.
Now, this is on basically on bacteria. So the following year, we did a follow-up study on that, where we got now a bigger number. We got 77 workers, nurses, and other health workers in the hospital I'm with, Makati Medical. And what we did was we told them, don't wash your hands after your duty, just come in. And we're going to do is put your hands in what we call a glove dip test, and then test that water for organisms, which we did. And then we did an in vitro. That means the same organisms that we were able to culture from them, we put them in petri dishes, and then we challenged it in the plate with the Monolaurin versus the isopropyl alcohol. And guess what? Again, they did beautifully together. So isopropyl alcohol works, but again, the isopropyl alcohol users, in the follow-up study that did in vivo testing, where we asked them to do the hand dip, the first, the third, the seventh, and the 10th hour after applying those gels, guess what happened? Again, the Monolaurin beat the isopropyl alcohol. But let me tell you first, there was washing of the hands first. And so we also examined those, and we found that 40%, the amount of removal of organisms was 40% with just soap and water, which is sodium lauryl sulfate. But with Monolaurin and isopropyl alcohol, it was better.
Okay, but let me summarize. Because again,
sorry.
what ends up happening here, just so you guys know, people who are just joining us, she basically runs on very scientifically. And then I kind of interject and summarize to make sure we're all on the same page. First, I want to say hi to our friends in Costa Rica. ¿Cómo están ustedes? Buenas noches.
Hello.
Yeah, we're also available in Costa Rica, so I'm thrilled to see you guys here. Y si alguien tiene una pregunta en castellano, también podemos ayudar ahí. And questions sa Tagalog, pwede rin at sa Bisaya. Game. We'll make it happen. So, in a nutshell, what my mom was saying, what Doctora was saying is early on she became fascinated because nga she met Cabara, right? Was it Cabara you met in Beijing?
John Cabara.
There you go. Honestly, John Cabara should be, I think, celebrated as one of the major inventors, phenomenal scientists of our era. He is Filipino. He was based in the States.
He's an American.
I'm sorry, he was American.
Yeah.
I'm sorry, misspoke.
White with blue eyes.
Okay, so he was a white American, and he did all these studies on the coconut. And when my mother met him, they were talking about the fact that the clinical studies seem to be all in vitro in the lab, right? And
Correction.
Okay.
The studies were all in vitro in the laboratory.
right.
Clinical is also human skin. It's
Okay,
always-
so those studies were all in vitro in the lab.
Yes.
But the challenge then was to see, can we do other studies that include human subjects, basically, right? So an actual use. And so the first two studies that she did were really rather compelling. I think I should emphasize here, these weren't the first studies ever. There have been many studies on virgin coconut oil and monolaurin, mostly in the lab, right, in vitro. Her studies were really among the first on people.
Yeah.
And what became interesting was seeing a lot of the stuff that was already proven in the lab panned out and validated in actual use, right? And two of those studies included using monolaurin versus isopropyl alcohol, which is a standard in disinfection for hospitals, with hospital workers, nurses, as they were coming off duty without necessarily washing their hands, to see how effective monolaurin was versus isopropyl alcohol. And at the end of the day, time and again, it showed that the efficacy was very, very similar, right? They both disinfected really well. The big difference is alcohol is drying to the skin.
Right.
So that's what we're seeing so far. Wait. Wait, because
I'm ready to go on.
I know. For this particular subject, I know I have to rein her in a lot. So we're seeing a rise in skin problems because of COVID, right? So what we're seeing is a lot more disinfection, which is important, a lot more hand washing, which is important, and a lot of wearing of PPEs, masks and goggles and gloves and such, which is important. But so we're also seeing a rise in skin problems. Also, a lot of the products used for disinfection, alcohol, chlorine, things like that, are maybe not allergens per se, but they're very irritating to the skin. So they denature the skin, they break down the skin's barrier, very drying. And some stuff that contains alcohol, for example, like in a hand sanitizer, also contains dyes and fragrances. So you're just adding problem upon problem, right? So in a nutshell, VCO, virgin coconut oil, and in a nutshell,
Barrier repair.
I just got that, sorry. So yes, in a nutshell, virgin coconut oil and monolaurin have been in the news a lot because a lot of their old studies are coming to the fore, and all of her studies, about how they are proven microbials, antimicrobials, excuse me. So here, I even started here without going to the studies just yet. I didn't succeed there. Um, can you back us up even more?
Okay.
What are virgin coconut oil and monolaurin exactly?
Okay.
And chemically, why are they good?
All right. The moisturizers that you're commonly asked to use on your skin may contain petrochemicals like mineral oil and petrolatum. They're really derived from the dregs, or the bottom layer of the ones that become gasoline and diesel.
It's
and
not
all that.
always bad. Mineral oil is very good for the skin.
But the difference between mineral oil and coconut and petroleum jelly is that it doesn't have the fatty acids that are present in the vegetable oils. The vegetable oils, name it, argan, olive, soybean, safflower, they all break down into this in the skin because of the lipases that are present in our tissues of the gut, skin, bacteria. They have lipases, so they break down what are called triglycerides, which is what oil is made of. So the triglyceride has a core of 3 carbons in glycerin, and to each carbon a fatty acid is attached. So that when the lipases break down the fatty acid attached to each 3 carbon, so you have first a diglyceride, and then it becomes a monoglyceride. That's glycerin with the 3 carbons, and to 1 carbon, because the other 2 have already been kicked off by the lipase, you have the monoglyceride. That's the monoglyceride. And then at the end of it all, fatty acids, what are called free fatty acids. And these fatty acids are active lipids. They are used in repair of cell membranes. Remember, all of us have just about every cell that we have, as well as the little things that are inside the cell, have a double lipid membrane. Those are made up of fatty acids.
Okay, stop. Okay, so far, we're looking at different oils and their chemical structure. Okay, and what makes virgin coconut oil special is how it breaks down. Is that right?
What makes it special and unique from the others is that, like the others, like olive oil, they're C18. They're very long chain, and they're partly unsaturated or fully unsaturated. 3 bonds that are unsaturated. Whereas coconut oil is unique among these oils because it has 65% are what we call 12 and 8. So they're small and medium chain, short ones. Whereas the others are unsaturated, and so they kind of bend with the coconut oil fatty acids. They're straight and flat because they're saturated, so they're like this.
But why is that a good thing? Why
Because
is
then when you
saturated
put
better
it-
than unsaturated?
When you put it on top of your skin, it becomes like a palisade. So it's similar to petroleum jelly, Vaseline. It becomes like a palisade on top, and it therefore helps protect your barrier. Nowadays, you'll hear it more and more. Aging skin has barrier defect. Barrier repair has to be done. Skin that has been treated with so much steroids, for instance, for your rosacea or whatever, that also has barrier defect. Skin which is getting older, skin which is exposed to all the chlorine, isopropyl alcohol, and all of those chemicals that are good for killing COVID, however, produces contact dermatitis, either an allergic or an irritant one, or even a photoallergy. We have somebody who cleans our swimming pool and tell you, black as anything on their face because of the chlorine,
The
until I told him
photoallergic reaction.
to cover.
Okay, so virgin coconut oil, in the end, the saturated fatness of it is actually a good thing, because sometimes saturated fats get a bad rap.
Correct.
And that's a little bit too simplistic an argument. So saturated fats from animal-derived sources can be an issue for heart, but saturated fat from the coconut is excellent. It's cholesterol-free. I'm sorry, if we start to jiggle, it's our cat. Sorry. So saturated fat for intaking, if it's from coconut oil, it's cholesterol-free. It's actually really good for your heart health and your body. VCO, because of the way that it is chemically structured, is excellent for your skin. It
Right.
breaks down into fatty acids that are quite native to the skin, so it really helps protect and repair the skin's barrier.
She's so
Okay.
good.
I listen.
Okay, so we mentioned two already. It's antimicrobial and it's broad spectrum. The reason it does that is that it breaks down the the lipid membrane, the envelope rather, of the bacteria and the viruses. That's why I've done a lot of studies over the years and shown Staphylococcus, which is a common bacteria in skin that is damaged by atopic dermatitis, eczema, things like that, including psoriasis. When you apply coconut oil, it's amazing thing is that number one, it kills the bacteria and virus that goes into the skin, which has barrier damage. And in addition, that barrier itself is repaired
Yeah.
by the oil.
Okay,
It's
let's-
amazing. And then I
let's-
have a third one, so you go ahead.
So I wanna split this up a little bit. Okay. Virgin coconut oil and monolaurin. Monolaurin, by the way, is also found naturally in breast milk. So
18%.
it's part of the whole immune boosting system that mothers give their children at birth. But to split it up a little bit, VCO and monolaurin are pretty amazing because they're both so excellent for the skin, right? We talked about they break down into fatty acids that are needed to the skin. They help protect the skin's barrier. They help repair it. But in addition, which is sort of the main focus of this session now, they really are effective antimicrobials. And you were just talking about how it helps kill bacteria. How does it kill bacteria, fungus, fungi, and viruses, which is on everyone's mind now?
Okay. Those short to medium length fatty acids of coconut oil are so compact and saturated, they can actually penetrate the envelope. They can penetrate that lipid thing of the virus or the bacteria. There's actually a very nice paper by a guy called Thormar with electron microscopic images of this, like a submarine. They go in and break up within minutes, so that it's therefore doesn't just kill viruses, it kills bacteria and it kills fungus. And I have a whole list of studies I've done on skin showing all this. But the most recent that I want to talk about, remember I started publishing in 2000, right? From my studies in 1998.
For the coconut oil.
Currently,
You started way before that for other
2019 and 2020. One of my residents just did a study on the use of coconut oil for atopic dermatitis, eczema patients. And she showed at the very end of this 4-week study that the number of staphylococcal organisms were eradicated, whereas in the control, 50% still remain. This is the more important part. She also did what we call barrier repair measures, and this is with 2 or 3 measures that we have to look at how much water is being lost, the amount of water that is there, and all that. And that she also proved was amazingly the barrier repair. So she showed the barrier repair and organisms. Plus, the second study is that, again, very recent, 2020, I believe, or December 2019, came from San Diego, I think. And it showed that babies who are, premature, tend to have bad, skin barriers. They're not very well developed. And so what this group did, they did a meta-analysis. They got all of the studies that are on babies that are premature, and by golly, they really showed that in babies that were premature versus who were given the coconut oil to apply, that they in fact survived, had better skin, and were able to,
So, but let me double down on this a little bit, right? Because it's a pretty big claim, and while there's a lot of studies out there, it's hard, I think, for people to get access to these studies, and even if you did, they're not the easiest thing for non-medical people to understand. Okay, so how exactly, like if I say a bacterium, a fungus, or a virus, is the action of virgin coconut oil the same as, say, azithromycin, or an antiprotozoal, or an antiviral drug?
different. Those
That's
antimicrobials basically act by enzymatic action, where they produce an enzyme or they capture the enzyme that the organism makes in order to make that organism ineffective. For instance, beta-lactamase is the best example, penicillin. What the organisms make, like staphylococcus, is they make beta-lactamase. And what the coconut oil does is that it prevents that beta-lactamase from being active. So that's how it does it. The third thing, because I know we're running short of time soon, is anti-inflammatory. This I did with a more modern study now. The others should, we kept progressing, using more and more new things.
I may interrupt you there.
Yes.
Because there's so much on antibacterial and antimicrobial. I'm curious, and I want to get this out there because it's important for people who are struggling with this infection now.
Okay.
So we talked about repair. Anti-inflammatory, we know this very well already from Monolaurin and
Coconut oil.
virgin coconut oil. But for example, okay, if I am already so dry from disinfecting, using alcohol on my hands, etc., can I just use virgin coconut oil?
Yes. You can use coconut oil. This is the beauty about it, is if you use the coconut oil, you're both moisturizing your hand, making it feel nice and soft. You should touch my skin. I mean, I'm 81, but gee whiz, it feels gorgeous from using coconut oil constantly. By using that, you are in effect putting into work what the coconut oil does best, being a barrier repair on the skin, because it provides the fatty acids as well as forms that palisade on the top of the skin, and it doesn't feel like petroleum jelly on the skin, which is very greasy. It has its uses, but
Petroleum jelly is super important. Don't let her give a bad rap. Petroleum jelly is actually really,
I
really
use it a
important.
lot.
Yeah, for
It has
some
its
things.
uses, too.
Absolutely. So it's important. But specifically to virgin coconut oil, specifically to antiviral, antibacterial, antifungal care. She has patients I know who have used it when having a big herpes eruption, when they've become drug resistant to valacyclovir, which is the
That's right.
typical drug.
Yes.
So she will actually use virgin coconut oil in the hospital with them, just constant massaging and rubbing. She also has them drink it, if I'm not mistaken, right? I have a question about that later. I know I want to get to. And then I know she's also used it for diaper rash because it's mostly fungal. No, sometimes it's also just an irritation of the skin of the baby. And I know one of the studies that's really compelling. Two studies that came out that were compelling, that were lab studies, not her studies. One was on HIV from years ago. Very compelling stuff. And then the other, we have on vmvinskin.com, we have a review of several studies that were done with virgin coconut oil and monolaurin for, and fascinating, HIV, staphylococcus, etc., and even coronaviruses. Now let me emphasize, this is not novel coronavirus. Novel coronavirus is a type of coronavirus, right? And both alcohol and virgin coconut oil monolaurin have been proven effective against some coronaviruses. So there is compelling evidence that virgin coconut oil and monolaurin would work the same way on the lipid exterior, of
Yes,
the
sir.
virus,
Right.
breaking it down.
Correct.
Okay, we have a quick question here about, are all VCO in the market monolaurin? Let me clarify that question a bit. All VCO contains monolaurin, right?
Yes.
Okay, because monolaurin is a byproduct. It is a derivative of monolaurin. But a question that we get all the time, and in fact we got it a few days ago, is, are all virgin coconut oils the same?
Okay. Dr. Fabian Dairit, the son of the fellow, Dr. Conrado, my teacher, my mentor, back in the 90s, he actually has a group now studying with the Philippine FDA, the Philippine PCHRD, and all those big shot people in government, which is a wonderful thing that they're doing. They're examining the VCO being produced in the Philippines. On my side, what I'm proposing to them is that I first do these studies using the coconut oil that we have in our farm. I think I can talk about this. I inherited from my father, co-inherited with my sister and a brother, a farm that he planted coconuts to when he graduated from agriculture from UP Los Baños in 1935. So he knew already from talking, I guess, with his American teachers at that time in UP Los Baños that coconuts was going to be very, very good. And so he started planting two coconuts. And so here I am in the year 2000 and thinking, I want that farm to become organic. So I developed it to be organic, to follow all the rules on organicity by the USDA. And by 2005, it became certified as an organic farm. And every year since then, it gets visited by these USDA people, and it continues to be certified USDA organic. Plus, in addition now, 2 years ago, we had Japan, Jazz, and Ceres, which is the European counterparts of the USDA in the US. They also come yearly and inspect the farm. So it's number one, it's really, really, truly organic. It doesn't have rice paddies or other things that are planted in between. It's coconuts. So then I decided I want it to be really cold because I began to study the anti-inflammatory effects of coconut oil. And so antioxidants are important. And coconut oil, in its what's called the non-saponifiable portion, has antioxidants.
Okay.
Fantastic.
Okay, I'm actually
So cold pressed.
I'm gonna interject. To our viewer, don't be sorry. That's why you're here. We need all of this, but my job is to, make it digestible. To our viewer who asked, are all VCOs the same? Even the ones, or are they good, quote unquote? I think was your question. Even the ones on supermarket shelves. So,
The answer is no.
right, no, but so, if you're looking at a cooking oil, right? Even the cheap, what they call RBD, which is refined, bleached, deodorized coconut oil. It's not virgin. It is processed. It's with heat, etc. Even that is better cooking oil for you than any other vegetable oil.
That's right, because it
Period.
has the same fatty acids.
Exactly. So it's still better for you, your heart, etc., etc., etc. Is that the best oil for your skin? No. Because there are chemicals that are used to process that oil that can cause problems on skin, particularly if you have barrier damage issues or if you have contact dermatitis. So barrier issues would maybe be atopic dermatitis, eczema, psoriasis, rosacea, etc. If you have contact dermatitis and have patch tested positive to certain allergens, those allergens might have been present in the processing of that oil. So for skin, it really is important to look for virgin, organic, because then you know it hasn't been processed with fragrances and heat and whatever else. I'm so sorry about the jiggling.
And look for certified organic.
Look for certified organic. In general, organic doesn't mean much for skin, truly, because so many natural substances are allergens. I like to liken it, skin and food allergens don't necessarily operate the same way. But to me, an easy analogy is, if you're allergic to bees, don't get stung. I don't care how organic the bee is, right? So organic in skincare isn't necessarily such a thing. What you need to look for is hypoallergenic. But for coconut oil, virgin and organic, they matter because there's less processing. You get a purer oil that's better for you. Another cold pressed, no heat, no enzymes. Another question that we got was, can you drink virgin coconut oil? The answer is yes. And if yes, how many teaspoons a day? What would your suggestion be there?
For that HIV study that was done by my friend and mentor, Dr. Conrado Dairit, it was 1 tablespoon 3 times a day, and it was again in the Indonesian group who studied it a couple of years ago, also used the 1 tablespoon 3 times a day. I think that might be a little bit much, unless you really have a flaring infection.
Mm-hmm.
I feel that about a teaspoon twice a day, or a teaspoon 3 times a day might be. We're doing a study right now on seeing what is the best dosage. So we'll come to you. But right now, you have to go by what they said, 1 tablespoon 3 times a day, doing it for HIV. But as a preventive, I believe it should be about half of that.
Okay.
So you can have about a tablespoon once a day is good.
Note that if you're watching your calories, It's high. It's not a low calorie oil, but a lot of the low calorie stuff anyway isn't necessarily good for you because it has other processing that's just not great. But just keep that in mind when you if you are calorie counting for your health. But it's good though. It's a good fat on so many levels. So I really wouldn't even worry about it.
What I suggest to people, excuse me, is I tell them to use it on cold things like salads.
That's right.
You can place it on salads. You could drizzle it on
Or
bread.
bullet coffee.
Yeah.
If you have bullet coffee,
Right.
you're full for
Oh,
the
yeah.
whole morning.
Drizzle
Okay.
it on bread and then put some cinnamon and a little bit of brown sugar. It's really tasty.
Okay, another session. I'm gonna rush through again because she now is working on a protocol again for VCO, so I'm gonna rush through things. Someone is asking the difference of drinking VCO versus MCT oil, and this is fascinating because MCT oil is not a bad thing,
Right.
but between the two, VCO wins out,
Right.
hands down.
MCT oil is, to the most part, I understand, and I stand to be corrected if I'm wrong. It comes from the origin is really from copra oil.
Mm.
So it's already an RBD, and then the end of it, of the, the 8, 10, and 12, the C8, C10, and C12 are then made into that. If they are to make that 8, 10, 12 out of virgin coconut oil and not from the RBD oil, I will take a look at it and do a study on it.
You have an answer that we have. Actually, it's gonna go up on vmvinskin.com fairly soon because I've been meaning to do it and I've forgotten. So thank you for the question. I'll get that up today. Another thing I wanted to point out is monolaurin. I won't show this is just a bottle of monolaurin, but I wanted to show you guys what monolaurin looks like, which is, it comes in these sort of, can you see that? Right? Waxy pellets. Whoops, I'm gonna eat that. You're actually gonna watch me eat some. So, literally, when I am fighting a flare, because I have an autoinflammatory thing, I'll eat like a handful of this. She recommends about a capful of it. So monolaurin you can actually, pardon me, take straight or drink your coconut oil. Okay, wait, we had another question about drinking coconut oil. These questions always come to the end. You're so mean. Okay, cold press just means no heat. Pardon me. Okay, it's a
Come
mess.
visit my farm one of these days when you go. It's so rustic and just a small little laboratory there. And
There.
where what we do is on the day of harvest. So the coconuts is a whole day thing because on the day of harvest they bring those freshly harvested coconuts, bring it immediately to the laboratory, which is on site right in the little farm. And then what they do is then and they're wearing scrub suits also. They're wearing gloves and masks.
Okay,
And things.
I have another question, and because she's gonna go, so I have to do this because she's gonna go. We have a question here on monolaurin tablets. Stick around. I'm gonna get rid of her and talk a little bit more about where you can buy stuff because I can't talk about products when she's here because it wouldn't be an ethical thing. But someone was asking about oil pulling. As far as I know, there aren't really definitive studies on that. But just if you look at the theoretical of it, virgin coconut oil is anti-microbial, right? Antibacterial, antifungal, antiviral. Swishing it around the mouth. I know I use it when I get canker sores for my aphtha, the lesions that I get. And cavities are an infection, really. So if you swirl with coconut oil, it might be able to help be an anti-carie practice. In terms of whitening the teeth, that I haven't really seen anything on. Theoretically, it might help because of the enamel, no?
Mm-hmm.
But there's nothing definitive that we've seen.
Okay.
Still, it can't hurt.
I'm actually doing a study soon, I hope, where we're using, because remember, COVID, go to the current problem, COVID virus, COVID-19 virus, how does it get into our body? It's through the face, right? The skin, that's why we're told to social distance and stay away from droplet infection and all that. So it gets there, and actually, therefore, the first entry of COVID primarily is, and it has been shown in studies, that the highest viral loads are in the nasopharynx and the throat. You have very high, of course, down below, but nobody goes down there to get samples. But these are very high amounts. So that therefore, by applying that coconut oil on the skin, on the exposed areas, and then also getting it into the lips and the mouth and gargling with it, you're getting quite a bit of the COVID organisms, as well as putting it in the nostrils and into the nasal passages and then breathing it in like they do in Ayurvedic. There's an Ayurvedic practice called Nanya or Narya, where they also put droplets of herbs. But if you use that, I believe, not proven yet, we're going to be proving it in the studies that we're going to be doing regarding the COVID itself organism, and not just any microbe, but specifically for that organism, plus any other bacteria that may be floating around that should be killed off anyway, because they confuse us and make things worse.
So quickly, I want to say thank you. There's Art of Surreal, I don't know if I'm pronouncing that right, and she wrote, I have used a lot of branded lotions before, but only VMV. Node oil helped and saved my skin from being very dry and scaly. Now I'm dry and scale free, best for my skin. So yay,
Nice.
that's awesome. Thank you. That's kind of what we live for. That's why we do what we do. Cold pressed, I answered already. Monolaurin tablets. Am I allowed to say while you're here where to get them?
Can I go now?
Yeah, I figure. Okay, guys, she's gonna go. And she's going to do more research. I'll stay around and answer just some of your questions very quickly about products. But otherwise, we'll see you next week. I think next week we're going to talk about...
Before I leave, let me just explain why I have to go. I continue to do studies. And for me to be believable, the people I submit the manuscripts for publication, they have to know that I am really a researcher more than anything else.
She's gonna go now and go research. So thank you,
Thank you.
and next I love you. Mwah. Thank you.
Love
See
you.
you.
You're a good interpreter.
Okay, thank
To
you.
take a picture of that.
I know I have to take a picture of the cat. I'll do that later. Thanks, Mom.
Bye-bye. Thank you, Lau.
Bye. Okay, so very quickly, just to address, if you are interested in getting the Monolaurin pellets, we do sell them at the clinic. They're not yet a branded VMV product. I don't know if you know this, but about 70% of VMV products start out in the clinic anyway as her prescriptions. So a lot of our products will start out as prescriptions from her or dermatologists to the patients. We'll get feedback from them, then we'll do the clinical studies, and if they do well, we'll turn them into products. So Monolaurin pellets can be found in our clinic, our research center. And you can find them on Facebook at VMV Skin Research Center and Clinics, or you can DM us here and we will put you in touch and help make that happen. Someone had asked about the best sunscreen. Is that right? Best moisturizer and sunscreen for oily skin. I mean, VCO, right? At the end of the day is really an excellent go-to. We use it a lot in our family for everything. The kids use it, the cat uses it, the dogs, everybody uses it. So it's a great moisturizer, even for oily skin. And sunscreen, I'm going to say Armada, of course, because it's awesome. For indoor and outdoor use. It has been the only sunscreen tested specifically for indoor and outdoor use, which includes blue light from the phone for years. So, on that note, since my mother has gone, who is the main the main feature, really, the main attraction here, I'm gonna start wrapping us up and saying thank you very much for joining us. Don't forget to follow your doctor's orders, wear your PPEs, social distance, do disinfect, do wash your hands frequently, but you can consider virgin coconut oil and monolaurin as additions or alternatives to your disinfection practices. A great idea, if you happen to be a health frontliner, is to use virgin coconut oil or one of our monolaurin moisturizers before you put on a mask or gloves or goggles, because it adds to a bit of barrier protection for your skin, and it helps the skin repair itself faster. If you have questions, please, let us know in the DMs and we'll try to get to them. We regularly answer questions here. We answer them on Facebook. Marlo here will assist me in answering stuff. My God, you're so KSB. Okay. Online and stuff. And we'll be doing more live streams every week, hopefully on different topics. Next week, I think we're interested in doing contact dermatitis and patch testing. So that'll be cool. And then I hope to have my sister on after her exams to talk about allergies and stuff like that as well. And yeah, if you'd like a teleconsultation with my mom, Dr. Viralia Rowell, same banana, just DM us and we'll try to make that happen. Very few things to end this session, just so you know, almost everything that VMV makes contains that organic virgin coconut oil that's certified, clinically studied, and published and stuff. That's in almost everything that we make, from makeup to creams to everything. And you can shop all of that at vmvhypoallergenics.com all around the world, or in the Philippines, vmvhypoallergenics.ph. And we can customize recommendations for you. If you've had a patch test, you can share with us your allergens, and we can customize recommendations based on your particular allergens and potential cross-reactants. So we can do that for you. Ending that, don't forget to subscribe to emails on our website so you find out about promotions and other great news. We're doing something now which is really cool, which is if you buy an essential, we donate one to a health frontliner or a community in need. So that's pretty cool. And finally, a lot of what we discuss here is on vmvinskin.com. Do follow us on Instagram, on Facebook, on YouTube, on Twitter, and follow me. I'm happy to answer questions and chat about skin and health and mommying and cocktails too, at Laura at VMV. So thank you again for viewing and all your awesome questions. For next week, contact dermatitis and allergens and patch testing. Submit your questions ahead of time and we'll make that happen. Thank you very much. Bye-bye.